Good afternoon, everyone, or good morning, depending on where you're located. I'd like to welcome all of you to today's live session in celebration of World Mental Health Day, titled How Right Now Supporting Mental Health for All. Today, we'll be talking about the How Right Now campaign, which was developed by the Centers for Disease Control and Prevention, or the CDC, to promote and strengthen the emotional well being and resiliency of populations adversely affected by COVID 19. And of course, many of us know that includes things like stress, a lot of us living with uncertainty, struggles with a lot of loss and grief. And so we'll be talking a lot about that in today's discussion. The How Right Now campaign is a national research based campaign that has reached a number of high risk populations that have had these challenges with different mental health challenges, and it has already reached over 430 million people and has demonstrated a positive effect on community. So I'm really excited for today's discussion. I'm joined today by three incredible panelists. The first of which that you'll be hearing from is Cynthia Crick, who currently serves as the manager of the How Right Now campaign and special projects advisor in the Division of Population Health at the CDC. She's led health communication projects for the US government for 25 years. During her tenure at the CDC, Cynthia has directed the development, implementation, and evaluation of national communication programs at the National Center for Disease Prevention and Health Promotion and the National Center for HIV/AIDS, viral hepatitis, STD, and TB prevention. She's also worked on a variety of CDC's emergency responses, from a communications lead on epidemiology task force during the COVID-19 pandemic to the internal communications project manager for the Ebola response. And prior to joining CDC, she worked as a US-based public affairs officer for the Peace Corps and served in a variety of other roles in the private sector. So Cynthia, really glad to have you with us. Next, you all will hear from Turquoise Sidibe. She's the Associate Vice President of Emergency Response, managing the CDC Foundation's emergency response, crisis, and preparedness programs. Notably, she's leading the COVID-19 response, where she has the oversight of over 250 programs domestically and internationally. In her role, Turquoise leads strategic planning, partnership management, budget development, and program implementation to ensure maximum coordination of resources and efforts in emergency responses. And prior to joining the CDC Foundation, Turquoise was selected for the Public Health Prevention Service Fellowship at CDC, in which she was actually awarded the Public Health Preparedness and Response Award for Excellence in International Program Delivery. And lastly, but not least, you'll be hearing from Amelia Burke Garcia. She is the Program Area Director of Digital Strategy and Outreach in the Public Health Department at NORC at the University of Chicago. She's a seasoned health communications professional with nearly 20 years of experience in health communication program planning, implementation, and evaluation, with specific expertise in developing and evaluating digital health communications campaigns and intervention studies. She spearheaded a number of really innovative communication projects and most recently has acted as director of the award-winning How Right Now campaign, which is aimed again at increasing people's ability to cope and be resilient amongst the COVID-19 pandemic. And she's also the author of a book entitled Influencing Health, a comprehensive guide to working with online influencers. So I'm so excited to have all of you guys here today. I think it's going to be a really fantastic discussion. I'd like to start off with you, Cynthia. If you could talk to us about the origins and implementation of the How Right Now campaign.
Thank you so much, Cecily. And I'm going to take you all the way back, excuse me, to March 2020. And March 2020 was an interesting month. It was when, as the United States, we weren't really gripping the impact of the COVID, which would become the pandemic, but the COVID epidemic. We were seeing about 800 cases per day, and that's not many compared to we get just yesterday. There's 52,000 cases, so a big difference. At CDC, we just had released $25 million for monitoring travelers and getting data on them and where they came from and how we can track at that time, again, epidemic. And we released $10 million for surveillance of COVID cases. Now, that is just a little tiny bit of money and actions that we were taking. Now, let me, if you will go, Amelia, to the next slide. So there was a group of us sitting in a small room face to face, because we didn't really at that point know how much COVID spread so quickly. And we decided there's something that needs to be done. We were hearing from people, calling the CDC information line, that we need, that they need help as far as their mental health. And so we were looking at what we should do. And there were a variety of groups that were, that we felt really needed our help as far as the mental health. And Amelia will be talking about this more, and this has been mentioned as well, but we felt older adults and their caregivers were important, that we need to address their health, and they were scared because of social isolation. And then at that point, CDC was defining who had pre-existing conditions that put them at risk for worsening COVID. And because of that, put them at risk for stress and related mental health challenges. And then we were just hearing, as you know, February, March, we were just hearing about the economic distress people were experiencing. And then people were at home and with social isolation. Let me see if I can say that today. And so some were experiencing violence. So this is an example of all of us brainstorming. And if you see on this board, it says CDCF. And at CDC, we knew we couldn't get this done quickly and start reaching out to all of these people and doing public service announcements and having web copy and providing information to those in need unless we had a partner. And that partner was the CDC Foundation. And it was extremely important for us to come together to be able to accomplish and help those facing stress and that needed help coping. So in doing that, we kind of, if you look at this, we kind of tried to define how people were feeling. And you can go, it's fine, Amelia, if you could go to the just regular slide as well. We were trying to define how people were feeling. And in doing so, we knew people were grieving. We knew they were afraid, very afraid. They were angry because they lost their jobs. They were lonely because there was isolation. They were stressed because who knows what was going to happen next. And of course, they were sad. And a lot of that is where those emotions is what we focused on moving forward with the pandemic. And so that's what the public was experiencing. And so and I'm going to hand this over to a minute to Turquoise, but we worked closely with them, the CDC Foundation, in a public-private partnership. And at this point, just so you know, the way the government works, sometimes it takes a lot to get tax dollars to implement things. And we were racing against time at this point because, I mean, the virus was spreading very quickly, as we all know now, sadly, and we were losing lives very quickly. So I'm going to go ahead and turn it over to Turquoise so she can pick it up from there and tell you how we did this. And then Amelia is going to fill you in afterwards. Oh, Cicely, I'm sorry. I was going to throw it to you. I apologize. Okay.
No worries at all. You already got us moving. So that's super helpful. And thank you, Cynthia, for giving us that background. It's really helpful to see, that whiteboard with where you guys all were starting and sort of brainstorming. Turquoise, I'd love to pass it over to you as Cynthia was just mentioning and sort of talking more about the public-private public-private sort of partnership between the CDC and the CDC Foundation, and just thinking broadly about well-being in the context of the COVID-19 pandemic.
Thank you very much. I'll start off by sharing a little bit about the CDC Foundation and then can jump in into how this project was created. And I love seeing the whiteboard as well. It's a really great visual. So the CDC Foundation helps the Centers for Disease Control, CDC, save and improve lives by unleashing the power of collaboration between CDC, philanthropies, private entities, and individuals to protect the health, the safety, and security of America and the world. The CDC was established by Congress in 1992 and began operations in 1995 to mobilize philanthropy and private sector resources. We are an independent nonprofit that was established by Congress to create philanthropic and private sector partnerships with CDC to support the critical health protection work. We believe that people, groups, organizations have greater positive impact, and we can all accomplish more together by aligning diverse interests and resources and leveraging all of our party strengths. Our collaborations with private and philanthropic partners help create greater impact than any one entity can do alone. And I think during the beginning of the COVID-19 pandemic, the CDC Foundation was in this unique intersection of government meeting philanthropy. Reflecting back to the beginning of the COVID-19 pandemic, we were beginning to quickly see like the economic recession affecting people's mental health and creating new barriers for people already suffering from mental illness and substance use disorders. And during the pandemic, we began to share articles as organizations and hear stories and share stories about adults reporting symptoms of anxiety, depression, having difficulty sleeping, eating, and starting to see increase of alcohol consumption and violence throughout the United States. In addition, as the pandemic began to unfold, and due to necessary public health measures, people began to experience isolation and job loss, which we know is linked to poor mental health outcomes as well. And even before we understood the impact of social isolation and I think in loneliness in regards to the pandemic at the foundation, we really did understand from research that social isolation is linked to poor mental health and physical health as well. Aware of the emerging research and hearing from our colleagues at CDC, we sprung into action to mobilize resources to support this growing crisis. The CDC Foundation, because we value partnerships, we submitted a response for funding proposal, an RFP, and invited several partners and posted it on our website. And we did select NORC as a sub-awardee. This campaign, in my opinion, really highlights the beauty of creating true, like a public-private partnership and the value of the CDC Foundation serving as a thought partner with CDC during emergency response. And the How Right Now campaign and Que Hasa Ora, I think just shows just the true value of how together bringing different organizations that we can make an impact and support mental health and well-being. And I'll turn it back to you. Thank you.
Perfect. Thank you so much, Turquoise. That was another really great overview of that role that the CDC Foundation and the CDC have together. Really interesting also to hear, you know, as you spoke about that relationship between government and philanthropy, really working together to address some of these challenges. I think one of the things we also noticed, which is actually, I think, research that came from the CDC, as well as you were talking about alcohol consumption and substance misuse, we noticed there was a 30% jump in substance misuse from 2019 to 2020, and part of that was in relation to the COVID-19 pandemic. And so really seeing how that has been a challenge and seeing the number of overdose deaths has been something that's been really challenging and also very much linked to mental health issues as well. So something we want to definitely keep an eye out for. And so I think what could also help us in learning more about this campaign is hearing more from Amelia. I know, Amelia, you've done a lot of this work in terms of the findings and the research related to the How Right Now campaign. So I'd love to pass it over to you to talk a bit more about the campaign.
Yeah, sure. Thank you so much, Celicia. And a really big thank you to the Global Alliance and the Mental Health, Public Health, and Social Work sections of APHA for their support in pulling together today's webinar. My name is Amelia Brooke Garcia, and I've had the immense honor since April of last year to help lead and develop this campaign, which I think is an amazing project. And as I will share, has had some positive effects on some of the most at-risk people amidst COVID. So just to kind of give you a little overview of the campaign to start, Cynthia and Turquoise did a wonderful job outlining kind of where the thinking for a campaign such as How Right Now came from. There really was this intention to develop a comprehensive effort to reach groups that would be at high risk for severe illness from COVID-19, and those that would be therefore facing adverse mental health and emotional well-being challenges due to the pandemic. The aims of developing this campaign really were to ground it in evidence-based health communication, psychology, behavior change theory, to base it in audience research, and really with the ultimate outcome of improving coping and emotional well-being and reducing the risk of adverse behaviors. As Cynthia mentioned, certain groups were sort of identified early on as potentially being at greater risk, both for illness, but as well as for secondary or sort of indirect health risks, such as mental health and emotional well-being challenges. 4 audience groups were identified early on as the focus for what would become the How Right Now campaign. This was because it was anticipated that they would be disproportionately affected due to the pandemic, as well as were not going to be, there were other programs that were addressing other needs for other groups within the CDC response and elsewhere. So these groups really needed support. And those groups are listed here. You can see them: older adults ages 65 and older and their caregivers, people with pre-existing physical and mental health conditions, people experiencing violence, and people experiencing economic distress. The overarching campaign, I will talk a little bit about this in greater detail in a minute. It really was developed and informed by research. So this was not just that we conducted some formative research and launched the campaign and it, lived on. The campaign really evolved over time based on ongoing data collection and the sort of changing environment and what we're hearing from our partners and from others around what the emerging needs were and how Right Now could be nimble and responsive to serve those needs in an ongoing manner. And one more unique part of How Right Now is that it is not a traditional mass media campaign. We actually didn't do any paid media until the end of 2020. And even then we did limited digital and social and radio buys. What How Right Now really is conducted through and with partners. It has, from the beginning, from the formative research phase, worked with partners and other trusted voices to understand the needs of their communities and how a program like How Right Now could serve those needs in an ongoing manner. I want to give you a little summary of the formative research that we conducted. I won't take you through all the details here, but you can certainly read more on the slides at a later point. But what we really aimed to do was what we've been calling rapid but robust formative research. So within a span of about 3 months, we conducted an environmental scan, data distillation, so looking at existing data sets and pulling out data points that would inform our campaign. And you can imagine at the time there was not a lot of data on COVID or mental health related to COVID. Social listening, so looking at public conversations in social media, what were people talking about, partner needs assessment calls. From there, our partners helped us convene listening sessions with members of their communities. We did a series of online focus groups, and we did a national probability panel with NORC has an in-house probability panel called AmeriSpeak. So we ran a survey of Americans. It's really important to note that this formative research process was iterative in that we were moving so quickly because the needs were so urgent that we didn't necessarily do this in what might normally have been a sequential order. And so as we were conducting the e-scan and the data distillation and the social listening, we were starting to work on key messages. Those messages were then run by our partners, tested in listening sessions and with online focus groups, and refined further as we continued along. The idea was really to maximize the time we had, gather as much data to ensure that we were really kind of getting at the real experiences and needs of these communities, and then trying to create messages and supportive materials and resources, and get them live and into the field as quickly as possible for people. It's also really important that all of this was done in English and Spanish. Really quickly, just a few highlights of what we learned, and these really informed the development of the campaign and its messages. We heard from people that they really wanted to know that what they were experiencing, what they were going through, that it was normal, that it was okay, that they were not alone, that it was not weird for them to feel the things that they were feeling or go through the experiences that they were going through. So really that validation messaging resonated with them. But there was this very clear nod and acknowledgement to the need for resilience and the need to cope and the need to kind of make it through this time. And so there was also this really important need for hope and resilience messaging as well. They needed tips and tools and tricks and resources that would get them through, but these needed to be actionable, low cost, low barrier to entry resources. They didn't want fluffy messages about going and meditating. They really wanted things that would help address where they were in their current lives in that moment. What we heard throughout our focus groups and our other data collection was that cultural sort of nuance, cultural sensitivity, really was important to being able to give people messaging and resources that that they would be able to engage with, and so really meeting people where they were, knowing that ideas like self-care were very sort of individualistic depending on which audience you were talking about, and also making sure that we were not just translating resources from English to Spanish, but really creating them for the sort of to include the cultural nuance of the populations we were seeking to serve. All of these findings ended up turning into what eventually became known as How Right Now, or Que Hacer Ahora in Spanish. The core of the campaign is a website that really honestly asks people how they're doing. And it allows you to sort of navigate towards a set of curated resources based on the emotion that you're experiencing. And so you can go into afraid or angry or grieving or lonely and get a set of resources along with some materials about what it means to be angry or lonely or afraid. We really wanted people to understand kind of what was going on when they were having these emotions. And so, and all of the materials were vetted by a panel of psychology experts that worked with us on the campaign. We developed a suite of different types of content. I mentioned before, being nimble and responsive to the changing environment. This is just a sampling of what we developed over the course of the campaign. We had some promotional items that were sort of How Right Now branded and helped promote the launch of the campaign. We also worked to develop a set of coping resources. These were tailored by audience. They also really looked at the fact that we needed to provide mental health support resources, but we also recognized that a lot of the mental health struggles that people were having were directly related to basic needs, challenges that people were facing, loss of jobs, potential loss of home, food insecurity. And we really wanted to make sure that we weren't being tone deaf with providing people with mental health supports when we weren't trying to address some of those basic needs before we got to the mental health piece. So we have a series of resources that link out to tip lines, hotlines, call lines, job banks, food banks, other types of resources that are really actionable and can be impactful for people's lives. And we also rolled out a series of talk resources based on our research that said that people were using informal support early on. They were also using formal support as the pandemic rolled on, but informal support, so talking to family and friends, was a very common way of coping. And so, but we all know that, you know, having a compassionate conversation, being supportive of people when they're having a crisis can be difficult. And so we created a conversation guide and a compassionate listening GIF, as well as some expert videos, and some celebrities actually lent their voices to do some PSAs around taking a moment to have a compassionate conversation. As we rolled into the holiday season, we rolled out some grief and gratitude content to really be supportive to people through the holiday season, knowing that this was probably going to be one of the hardest times for people, whether that was because of a loss of a loved one or needing to still social distance, or being worried about putting food on the table. Any of those moments or experiences could impact somebody in a negative way in terms of their mental health, and we wanted to be there to support them. We rolled out gratitude content because gratitude is a coping mechanism through grief in the literature. And so we wanted to make sure that we were actually giving people not just supportive resources for their feelings of grief, but also encouraging gratitude as a way to sort of move through the grief. There are many other types of content that we've rolled out since then, but this is just a sampling. And it's also really important to note that the website did not want to reinvent the wheel. It really wanted to use what was out there that was evidence-based, that was quality, and then fill gaps. And so this is where you see the gaps that we filled. And we link out to many other great quality resources that can provide support in a number of other ways. Like I mentioned, we have been through and with partners from the beginning. This is just a sampling of our partners that participated. We convened them monthly, and we learned from them. We listened to what they had to share with us. We engaged them around key moments to bring them together to do activations, and they posted in a variety of ways across social, virtual kind of meetings, town halls, things like that, text messaging campaigns, in-store television rotations, a lot of different ways. We also worked with celebrities and online social media influencers. You can see a couple of the great posts here from Kris Jenner and Melissa Joan Hart. They took our messaging, they crafted their own stories, they shared our resources over the course of the last year and a half, and were really impactful in driving some visibility of the campaign. And then finally, as I mentioned, at the end of 2020, we started to do a little bit of ad buying to reach audiences who may not otherwise be seeing our messages. So we ran digital and social media ads, and we also ran some radio ads in Spanish. And then those ran through the spring of 2021. Really quickly on evaluation, we just released our evaluation data in July. It's just really important to note that what we really aimed to do with this evaluation was to assess both process and outcome impacts of the campaign. So from a process standpoint, we looked at context, implementation, and reach. And from an outcomes perspective, we looked at the impact of the campaign on audiences' knowledge, self-efficacy, perceived susceptibility, information seeking, behavioral control over time. These are just some of our evaluation questions, again, noting under process about the context and implementation and outcome. We really looked at messaging and materials in terms of exposure and receptivity, and also how those were exposure to the campaign messages impacted awareness and beliefs, information seeking, and coping behaviors. In terms of our methods, we ran a series of surveys starting back in May during the formative process, but those continued throughout the following year. We also tracked partner activities through the end of December. And then we also tracked our digital, social, and radio ad metrics. We looked at website Google Analytics, And we also conducted ongoing social listening and environmental scanning. So looking at what was happening on a continual basis in social media and in the literature. As Celicia mentioned at the outset, the campaign reached more than 437 million people across all of our different channels of outreach and dissemination. In terms of the main takeaways, we were thrilled to find that, what I had mentioned at the very beginning, that the nimbleness and the responsiveness that the campaign really took on in order to kind of evolve as the pandemic evolved and meet people where they were as their needs changed. The campaign was very successful in doing that and in meeting those priority audiences where they are with what they need when they needed it. These adaptive techniques, in fact, resulted in increased reach of and engagement with the campaign. So it was a positive thing to reach and engage our priority audiences. It also just overall increased the reach of the campaign more broadly. It also drove community engagement online and off, and I may get into that a little bit later. But most powerfully, and when I am just, as a health communicator and working in this field, this is one of my proudest moments, how Right Now is effective with the audiences that reported the greatest suffering in the last year. So people experiencing violence, experiencing economic distress in communities of color. These groups reported the highest levels of stress and discord in the family. And amongst those groups, we saw positive campaign effects for increased, in terms of increased resilience, increased use of self-care strategies, and increased community engagement. So just a couple of summary and implications, and then I think we'll get to some discussion. We know that the uniqueness of the pandemic and how rapidly it changed meant that the campaign had to be nimble and flexible. It could not just be sort of put up and left up and hope that people go to it. We had to be active and proactive and thinking ahead and hearing from our partners about what communities were needing on an ongoing basis. The synthesization of multiple streams of data really enabled us to be able to do that successfully. We actually did, and I didn't present it here, but we do have some data on trust and messengers. And in fact, influencers and celebrities were less trustworthy overall, but for communities of color, they were actually one of the more trusted messengers. And in fact, they helped increase the reach and the engagement with the campaign amongst communities of color, I think about by 20%. Our targeted ad buys and influencer outreach increased the reach, especially among Spanish speakers. And then ultimately, these adaptive techniques, again, resulted in increased reach of the campaign and engagement with the content. The most effective messaging offered what we call our 1-2 punch. It was both that acknowledgement and validation message along with something to do and action message. And we saw this both in terms of the resources that people accessed on the website, as well as what we tested in our survey. In terms of the most common experiences, we saw differences between English and Spanish speakers, with grief being the most common emotion experienced amongst English speakers, and fear being the most common experienced emotion amongst Spanish speakers. We saw, again, this happen, we saw data from the website traffic and engagement and downloads, as well as what we saw on social media from our social listening. So I'm going to end it there. I'm going to turn it back to Celicia. Thank you all for your time and attention. I'm really excited for the rest of this discussion.
Thank you so much, Amelia. That was fantastic. I feel like I learned more things, even though I've seen these already before. So that was fantastic in describing those findings. I want to pass it over to Cynthia. Just if you could talk briefly about what do you think some of the next steps are for the How Right Now campaign? Oh, and I think you're
yeah, I'm unmuted now. Celicia, I'm sorry, I said your name wrong before.
No
I've
worries.
corrected it. Thank you. So what are the next steps? Nothing has changed. Let me just say this. We are very concerned about the population. And as Amelia stated, there are certain populations that are most affected. And a lot of those populations are what we talk about as social determinants of health. So people that where they live, where they work, and where they play, where they worship are not places that are conducive to good health. So they may be experiencing economic stress. They may not have healthcare, easy access to healthcare. There's a variety of different things can impact them. And a lot of those populations 37% of Hispanics that were polled are actually responded to a poll were having symptoms of anxiety and depression. And again, those responding to our survey, 35% of Black persons were having symptoms of anxiety and depression. That is not that different if you roll it back to April 2020. We are still seeing a lot of Hispanic or Latino populations in April 2020, 42% of those responding were experiencing symptoms of depression or anxiety, and 39% of Black populations were experiencing depression and anxiety symptoms. So why I bring all this into it is those are the populations we need to target. We need to reach those populations and provide them with resources and actionable messages that they can move forward and get the help they need. So let me just say we're partnering to do so. We are partnering with the CDC Foundation and Turquoise. Please jump in again if you want to. And we are moving forward with that effort to address populations that are working with populations that are dealing with social determinants of health, that also we are addressing populations that also may be suffering from chronic diseases like heart disease, diabetes, et cetera, and that may be affected as well from COVID. So I think that's it. I do see we have a question. Do we want to answer that now, or shall we wait till the end?
If you'd like to answer it now, you can feel free to. I think it speaks well to actually one of the first questions that I wanted to ask you all. So
yeah, actually, we don't collect immigration status with CDC data. We never collect immigration status data because this was an online survey. I will tell you it's 50,000 people, so it's not a small survey at all. But the interesting thing is, and Amelia, if you want to jump in here, when we looked at how people were feeling and when we did the evaluation, the Hispanic Latino populations were the highest emotion they were feeling was fear. And I think that is something maybe linked to immigration status. I don't know, Amelia, you were leading that effort as far as the evaluation. Your thoughts on that?
Yeah, so we didn't actually ask any questions about immigration in our right now evaluation, but we did do an analysis of our formative data. And Celicia, I just actually shared a link to the paper in the chat, and you can share that, or the administrators can share that more broadly with the panelists, the participants. It actually is an analysis of our formative data through the lens of social determinants of health. And what we did find is that people's struggles with their mental health and their emotional well-being the time would have been May, June, July, were very much wrapped up in COVID, but also tied to other things that were going on. So for African Americans, Black Lives Matter protests, a lot of the things that were going on there, those were sources of additional anxiety. And likewise for Hispanic Latinos, the worries and the concerns around immigration, those were also sort of coming to the forefront in terms of what they were experiencing in that moment. So we can't, and we didn't really parse out COVID versus these other environmental factors that were happening in the moment, but they certainly were a factor, and they're really important to consider in terms of people's mental health. And I think that gets to that point around why we chose to share certain types of resources that were not just mental health supports, but also trying to support some of the other kind of basic needs and things that people were experiencing. And I think in this next phase, the opportunities to provide supports to some of those other experiences will be incredibly important.
Yeah, thank you so much, Amelia. And I mean, that was one of the things that you mentioned that I thought was so important. Really want to reiterate to the audience that it's not just thinking about mental health challenges that people may be having, but if your basic needs are not being met, it's really hard to also just address the mental health challenges. So really great to hear that part of this platform, and I think part of how it was able to just reach that many people, remember it's over 437 million people, right? Connecting them to the resources that they need. I think one of those pieces with stress and anxiety is a huge part there. I'm wondering, Turquoise, if there's anything that you wanted to add in terms of next steps regarding the How Right Now campaign. I know Cynthia already started speaking to some of ways to address different disparities. I didn't know if there was anything that you wanted to add as well to that.
So I think Cynthia covered it, and Amelia kind of was hinting at of where we are hoping to move forward in this next phase of How Right Now. And I think we are excited to build upon, what we have learned and understand how to address current needs from various community groups. And so that should actually start taking place as early as next month for our next phase of the work.
Great. And Cynthia, is there something that you wanted to add?
I want to jump in there. We have a variety of different questions as well. How do you want me to? You tell me how we're going to handle this.
I will keep going through them. So there's one in here. There's a number that's kind of asking about different identities for folks and how they may have been impacted. Part of that is talking about higher risk populations and or thinking about information regarding gender and sexual orientation. Was any of that information collected in your surveys? And Amelia or Cynthia, would either of you like to answer that and speak to those populations?
Well, we didn't really factor that in because there was not, as far as by gender identity, because that was not collected at the time, nor did we consider that with the How Right Now research. However, I am happy to say, as in July of 2021, I believe it was in July 2021, we have started to collect data by gender identity. And I'm going to put in the chat the actual mental health household pulse survey, which is CDC does. And so as we move forward with How Right Now, we're going to have access to data and how people are feeling. And I'm going to put this right now, and how people are feeling based on gender identity, and we can parse it that way. And so that's an exciting change that we've implemented.
Awesome. Thank you.
And Celicia, if I could just jump in and say that while LGBTQIA peoples were not a primary audience for the campaign, we consider them as a subgroup along with sort of racial and ethnic minorities. So a number of our partners that participated were partners that serve that community. So for instance, we worked with Human Rights Campaign. They were one of our early partners. We also did a podcast episode with a podcaster that reaches a lot. She's not a primarily she's a sexual health educator, but a lot of her following and listeners are members of the LGBTQIA community. And what we did is we sort of did a story of it involved Human Rights Campaign, one of Human Rights Campaign's old student ambassadors. He's aged out of it. But he, in fact, is a gay man, Black African-American man living in San Francisco, who's an artist and was unemployed because of COVID. So he sort of hit a number of boxes in terms of being affected from a number of dimensions because of the pandemic. And then we ended with sort of how right now and its supportive resources. We do have a number of things on the website that are there to support the LGBTQIA community. But it would be nice to, moving forward, continue to build that out.
Definitely. Thank you so much. That's super helpful. And I know we're getting some really amazing questions in the chat. One thing that I also wanted to ask all of you really is, in the context of the COVID-19 pandemic, right, it has had a disproportionate impact on communities of color, on our low-income communities. That's not just in terms of like caseload, but also in terms of mortality and deaths. And now also we're talking about mental health and the impact that it's had on different communities. And you guys have already started to allude to these different challenges. I was wondering, maybe we could start with you, Amelia. Could you talk a little bit more about how this campaign really addresses disparities in mental health? And maybe I can pass it over to Turquoise and Cynthia to add on to that.
Yeah, so, I think it's interesting because the 4 priority audiences that were identified to be served by what eventually became known as How Right Now, it really was about disproportional impact. And so the audience groups are interesting because they aren't specifically demographic in nature, right? You've got your older adults ages 65 and older, but the others are really sort of psychographic profiles. And so they're cross-cutting across a number of different groups of people from who potentially are from all walks of life, but share that common experience of, losing a job or losing a loved one or being lonely or being fearful of being sick or being deported or having something else happen to you that could really weaken or threaten your life and the livelihoods of your family. And so I think what we really tried to do was recognize that there were groups in this country who were going to be really at a disadvantage. And those disadvantages come because of the nature of the pandemic, but those things all have already existed. They've existed for a very long time. And while we weren't setting out to necessarily directly address those, we knew that there would be people who would be facing more challenges than others. And so we wanted to be there for those people. And I think what we saw in our data and our evaluation is that How Right Now was successful in doing exactly that. There were certain groups within our 4 priority audiences, older adults, not just in our own data, but in other data that have been released. They've generally been okay through this pandemic, right? I think a lot of people thought there would be a lot of loneliness, a lot of depression, but older adults have fared generally okay, and that's what we saw. But for younger people, for communities of color, for people whose livelihoods were at stake, or who were vulnerable because they no longer had their other supports and their networks to be able to kind of be safe, those groups in particular were experiencing much higher stress, much greater worry. And I think that seeing that How Right Now, its messages actually increased coping and increased resilience amongst those groups is exactly what we wanted to do. And so I think only kind of honing in on those groups further and knowing that those supports and the needs are even greater now, a year and a half into the pandemic, and they will continue, right? So mental health being both the long tail coming out of COVID whenever we do, but also knowing that the things that worry people, the structural barriers, the social barriers, the racism, the homophobia that exists, those things were there before COVID and they will exist after COVID, and we need to continue to provide support to those people that are suffering. I think those are really important things to consider and give the opportunity for this campaign to live on long beyond COVID.
Definitely. Thank you so much, Amelia. Turquoise or Cynthia, is there anything that either of you would like to add to that?
The only thing that came to mind was, I think as Amelia alluded to, is that we were quickly trying to learn from our like lessons learned and really trying to reach certain groups of people through influencers and through celebrities as well. And I think that also just speaks to allowing people to see messages in multiple ways. I think that was also our goal, and not trying to, depict one way to, receive a message, because if a friend says it versus celebrity or influencer, it can have a larger impact. And I think that, makes this campaign dynamic and also able to have a broader audience.
Absolutely. Thank you. And Cynthia, I think we got you on mute again.
Sorry, you guys, my dog keeps barking, so I keep putting it on mute. One thing I want to add is that we are seeing in a younger population, and not stratified by race or anything else. We are finding that up to 50% of people are actually feeling stressed, have symptoms of anxiety and depression. That's of people that are younger, so like 18 to 29. Folks are really experiencing mental health challenges, where, as Amelia said, older adults, not so much. I think it's like 15% of older adults right now are experiencing mental health challenges. So as we move forward, we need to look at that data, as Amelia has said, and see where we are. And those are, the older adults are not the population whatsoever that are experiencing any kind of challenges. So that's where we are.
To that end, actually, Cynthia, there's a number of questions in the chat from our audience asking about whether or not there's been any information gathered on children and adolescents in particular. I guess I'm wondering if the campaign has already reached, I know as far as influencers go, a number of my younger siblings, for example, have connections to a number of influencers in social media. So I'm just wondering if you guys have had connections with children and adolescents, and also have, thought about additional ways of helping to support mental health for them. And I'll start with Amelia.
No, we have not actually worked to understand the needs and sort of the experiences of children or adolescents in terms of how right now. It is something that we are at least preliminarily kind of thinking about. It's been something we've discussed. It could potentially be something that could be done in the future. But on how right now we have not. I do believe there is other work being done though for youth and adolescents. And I don't know, maybe Cynthia, you might be able to say more about that.
I am hurrying and going to give a link to all of you. There is a mental health website at cdc.gov/mental health. And we are doing a lot of work in that area. I am racing to try to find this for you. And how about if let me just say this, how right now is not doing this. There are a variety of people at CDC that are. We have one project that we were working on, and I cannot answer that for you immediately. I'm sorry, but by the end of this, I will have the resource and we'll put it into the chat. So I apologize. The answer is not immediate.
No worries, Cynthia. That's totally fine. And I've shared that link with everyone in the chat too. I know our audience has been so engaged, and I apologize, but we're actually running up on time. So with this last few minutes that we have, I actually want to kind of finish all of us off with a bit of a speed round, and hopefully this gets to some of the questions that our audience members still have in the chat. I just want to ask you guys if each of you, maybe for 30 to 45 seconds each, could let us know what is your general sort of piece of advice that you would give all of the audience members here about how we can support mental health for all. Okay, so each of you have 30 to 45 seconds each. I'm gonna semi-time you here. Let's start with Turquoise. What would you leave the audience with?
Oh, that's a great question. For me, what comes to mind, I think it's being aware and even maybe modeling your own mental health for yourself, right? And so if you can't, you have to take care of yourself to take care of others. And I think trying to be an advocate and create space for yourself naturally might create space for others. And what comes to mind for me as I lead a team and do this work is that I'm bringing mindfulness exercises, to meetings. I'm telling my team, let's take a mental health walk. I'm just trying to create conversations so we can check in and just be a support for each other. And I think this will help prioritize not just myself, but also create a space for others as well. So that's what comes to mind.
Love that. Love it. Cynthia, you next.
I think working at CDC is an honor, and I worked with some amazing people. And certainly it has been stressful for us as the public health workforce, the federal public health workforce, let me say. And expressing gratitude to all of my colleagues and both inside and outside CDC, and as well as my family, is very empowering to myself and to them. And so I think it relieves stress. And I think as you move through your day, thank people, express gratitude, and you'll be amazed at how good you feel and how good they feel. And it really relieves some of that stress. So I know it's something little and it's something we promote as an agency, but try it.
Great. It's the little things that count, everyone. And
It's the little
Amelia.
things that count. Yes.
Sure. So I'll close this out with two thoughts. First, I come from a research organization. So let research be your guide. There isn't a one size fits all for this. And as a lot of you talked about, immigrants, refugees, children, they're all very unique populations. And I would encourage you to spend some time hearing from them. I'm sure you already do, but as it relates to designing mental health supports for them. I think listening to what they're going through and what their needs are and being responsive to those is really key. And the other thing I'll say is healthcare is a human right. And without that, people are not getting the support that they need, whether that's physical or mental. And so it's really important for everyone moving forward.
Definitely. Thank you all so much. This was absolutely, Cynthia.
One more thing real quick. My very wonderful colleague, expressing my gratitude, has put in the chat the project I was trying to find quickly for the National Academies about well-being for children. Perfect. So please go ahead and take a look at that.
Wonderful. Thank you so much. Again, everyone, thank you all for coming out today. I think this was an incredible discussion. I apologize that we couldn't get to all of your questions, but I'd like to again thank our panelists, Cynthia, Turquoise, and Amelia for joining us. And I'd like to thank the Global Alliance for Behavioral Health and Social Justice and the APHA Mental Health and Social Work sections for hosting us. This was incredible. I hope everyone has a great rest of your week, and remember to think about the little things and appreciate each other. Have a good one.
Thanks so much. Bye.
Bye.
Bye. Thank you.